you, Matthew. Good morning, supervisors. Good morning, community. Matt Willis, Public Health Officer. Thanks for the opportunity to provide a COVID-19 update for today. Up can I have my slide, please, Alvaro? We'll start with reviewing the data, some of our numbers, talk about our trajectory through the Omicron surge, and then what this means for us in terms of our ongoing policies. This is our epidemic curve since the start of the pandemic, and really shows dramatically how the Omicron surge that began around December 20th really has been categorically different experience. Much more contagious strain, ultra contagious, also characterized by less virulence. And I'll share more about that in a bit. But you can see that we had to completely revise our y-axis, the vertical axis on our charts here, just to accommodate the high numbers of cases. We had 625 cases on January 4th, which was our peak. Next slide, please. This is a blow up of that most recent interval, the Omicron surge. The first case detected on December 17th. And we can see that it has risen. And now you see signs here that our peak, the peak number was, as I said, January 4th. Our average peak time was around January 9th, that week, in the first week of January. And now we've seen steady declines since then in case rates. Next slide, please. We also look to other indicators to know where we are relative to the Omicron surge. And this is our wastewater data. We are collecting wastewater from a variety of sources across the county. And this shows, importantly, two things. One is that it looked like before the Omicron surge that we were actually starting to come out of the Delta surge that had preceded it. Our wastewater is a more sensitive indicator of actually the amount of virus in our community now, because it precedes when people develop symptoms and when they go to get tested, and then the delays in testing. So we now have evidence that wastewater actually more sensitively detects transmission at the community level. We saw a decline just before the surge in Omicron. Then around December 15th, we started seeing more Omicron activity. Our first case was detected on December 17th. And now we're seeing the peak in Omicron around the first week of January there in the wastewater sampling as well. Next slide, please. And then the last thing we look to really be clear that we are past the peak is our percent positivity. And we are seeing also declines in percent positivity among those who are tested. Next slide, please. This just reinforces what we have known all along, which is the most important thing that we can do to protect ourselves is to be vaccinated. These are case rates by vaccine status in Marin County, and shows that people who are unvaccinated are about 7 times more likely to be infected than those people who are vaccinated. And then on the bottom there, you have the lowest risk group, which is people who have been boosted. They are about twice as protected as people who are fully vaccinated but not boosted. Next slide, please. And then we look elsewhere just to see whether or not this pattern is something that we can see reinforced as sort of a characteristic of the shape of the Omicron surge. And we see that in New York and London, indeed, it's a very similar pattern to our own. Also importantly here, we also see potentially a sign that while the decline occurs both in London and New York, it doesn't end. It's a longer taper. And in fact, in London, it seems to have stabilized at much higher rates than it had been before the Omicron surge began, which might be an experience we should anticipate here. Next slide, please. These are our hospitalization rates. What this shows is that we are, as we would have expected, given the large number of cases, that we have seen increase in hospitalizations. Today, there are 21 individuals in the hospital for COVID-19 infection, 6 in the ICU. We have separated out in that shaded part on the right, we have separated out the incidentals. There's about twice as many people actually in Marin County hospitals with COVID-19 infection, but we estimate based on reports from the hospitals themselves that about half of those individuals are actually in the hospital for another reason than COVID-19. What we have here are those who the hospital assesses would not be hospitalized if it were not for their COVID-19 infection. So we are separating people who are hospitalized for COVID-19 versus those who are hospitalized incidentally with COVID-19. Next slide, please. And this really shows dramatically that uncoupling of case counts from hospitalizations. This is our epidemic curve with regards to our hospitalization rates and then with regard to our case rates. And you see they track very closely through the previous three waves that are very obvious here. And then we hit our Omicron wave and case counts rise dramatically, but hospitalizations don't rise in the same proportion. And that's been one of the most important features of Omicron, less severity, especially in a highly vaccinated community. Next slide, please. These are our vaccination rates as a county. 140,000 of our residents now have had booster doses. We are still the most highly vaccinated county in the state of California in all categories of age and with booster status. Next slide, please. These are our booster rates by age and shows what we would hope to find, which is those residents who are most vulnerable and most need the protection of the booster are our most highly vaccinated populations, our older residents. 81% of our residents above age 65 are fully vaccinated and have had a booster dose. About 70% of our entire population above age 35 has now had a booster dose, which means 30% have not. And they, as I showed in the previous slide, remain at risk. So we are still encouraging residents to obtain the protection of the booster and have multiple appointments available to walk in at numerous sites across the county. Next slide, please. This also just shows the vaccine effectiveness. I think the proof is in the outcomes when it comes to vaccines. This shows that people who are unvaccinated are 7 times, 29 times, and 25 times more likely to be infected, hospitalized, and pass from COVID-19, respectively. Next slide, please. So this is one of the most important questions that I think we have been receiving over the past couple of weeks, and has been an active topic of nationwide dialogue. So I wanted to address this clearly for us as a community. And we'll spend a few minutes on this. The question is, are we reaching the end of the pandemic? So let's start with some definitions. So a pandemic is a global epidemic. So what is an epidemic? An epidemic means increased case rates of a given disease above expected rates for a given population. So it is relative to an expectation of what is normative. Endemic, people are talking about, are we reaching an endemic phase? So we have a common understanding of what that means. Endemic means expected rates of an established disease in a given population. So that would be something that we are familiar with, we are known, and it is expected. It does not mean necessarily that it is harmless or that there's an absence of serious illness or death. That's not what endemic means. Next slide, please. So importantly, we can think about other endemic diseases that we are expecting COVID-19 to join and be seen in parallel to other similarly threatening diseases. Other viral respiratory endemic diseases include influenza. The numbers for influenza are also staggering. 10 to 40 million symptomatic illnesses every year from influenza, and 30 to 50,000 deaths annually from influenza. Respiratory syncytial virus. That might be a term that's unfamiliar to many. That is a very common virus. It's the most common cause of pneumonia among people under age 5. 50 to 60,000 hospitalizations annually in the United States, with 100 to 500 deaths among people under age 5 in the United States. And then above people of over age 65, 150,000 to 200,000 hospitalizations and 10 to 15,000 deaths. So just influenza and RSV, common endemic respiratory illnesses that we have lived with as a society for decades. And this is, we are seeing COVID-19 as beginning to emerge as a parallel respiratory virus disease threat. Next slide, please. So will there be more variants? The answer, unfortunately, is it is very likely there will be more variants. We've had at least 20 different variants now in the past. Omicron is pretty far into that Greek alphabet. And that's just because SARS-CoV-2 changes frequently. And humans and animals are infected globally, and that's a continuous source of new variants. We already know that Omicron subvariants are emerging. We're starting to see more and more. In Denmark, there's now a dominant subvariant of Omicron, and that will continue to probably spread, although it doesn't seem to be behaving much differently than the first Omicron variant. Next slide, please. So then what does that mean? Will there be more waves? And that's also likely because there will be more new variants. It is also likely that those new waves will be less harmful than past waves for a few reasons. One is that we have stronger collective immunity through vaccinations, especially in communities like Marin County, where over 90% of us are fully vaccinated. Most of us have boosters. And then the fact that past infection also confers protection. So that combination of past infection, which is now more important because of Omicron and it infecting so many individuals, those are two sources of immunity. We also know that future variants will tend towards less severe forms because that's generally how viruses evolve, to be less virulent and more contagious. And then finally, we have better understanding and tools. We have better science. We have, our vaccines are improving, our therapeutics are improving, and then we have a better understanding of how to prevent transmission. Next slide, please. So what that means for us is that we are, in fact, approaching a relationship with this virus that is endemic insofar as it is expected. It is routine now, we're 2 years in, and we will start seeing it in parallel to other known viral respiratory illnesses. These are the three pillars of what I see as sort of the framework that we will apply to the next stages of our pandemic response as a community. And I'll go through these individually. The first is layered strategies. The second is having a balanced response. And the third is maintaining a community focus. Next slide, please. So layered strategies, this is basically the things we've learned over the past 2 years and how to manage this pandemic. First, we'll be monitoring data to guide our response. Our epidemiology team here in Marin and then CDC and California Department of Public Health are all now have new data tools available to ensure that we're monitoring cases as they emerge so we can have rapid adaptation and response and awareness. Vaccinations are still by far our most important single tool, and vaccinations will remain important to us. Either regular routine vaccinations, say annual, the way we do with flu, or episodic vaccinations that might coincide with new variants during surges. The other layer is our personal behaviors. This is where mask wearing, social distancing, and hand washing come in. Testing. Testing will be routine and available to all for personal use, and we're already seeing that happening now with more tests being available from the federal government coming into our households. And then treatments are an increasingly important element of our response. More and more effective treatments coming. We now have 4 treatments available that are really effective in Marin. Very small supplies of those treatments currently, but they will increase manufacturing. And those treatments in the future will be aimed at preventing the worst outcomes and be more available to our residents. Next slide, please. So the next pillar of our endemic response is maintaining balance. And this has been, I think, one of the most active topics of dialogue over the past couple of weeks. Are we going too far? Are we not doing enough in terms of our policies? So we want to make sure that our future policies are balanced. So we need to define community health holistically in terms of mental, social, physical, and economic well-being, and not merely the absence of disease, or not merely focusing on only preventing COVID-19 transmission as our only organizer around our policies. So we need to examine the cost benefit of COVID policies in holistic terms to prevent the collateral harms that might be associated with too restrictive policies. We need to follow the best available science, and we'll be shifting from community level policies and mandates to individual risk management and decision-making generally. Next slide, please. And then finally, maintaining a community focus. The biological reality of this virus is that it's spread from person to person through respiratory, through the air, which means that we are mutually dependent upon each other in both public and private settings. So this is not just a sort of an ethic or an idea of community responsibility. It's a biological reality that we are mutually dependent. So our successful response relies on communal action, and that's in vaccinations, masks, staying home when sick, et cetera. We also, as a community, need to be able to respond quickly when conditions change. Over the past few weeks, as we've changed our policies to be responsive to Omicron, some have seen this as a sign of inconsistency. But in fact, it's a sign of responsiveness and flexibility that is incredibly necessary for us to maintain our health in a situation when the conditions themselves change. When the virus changes, we need to change our approaches, and that's a flexibility and adaptability that we need to maintain at the community level. And then we also recognize the spectrum of risk among our residents, and we need to focus our efforts on supporting the most vulnerable. Next slide, please. So that's the big picture, just trying to set the stage for as we come into an endemic understanding. We're not there yet. I imagine we'd have 2 to 3 weeks more of high levels of transmission, but just ending with a couple nuts and bolts of where we are right now. One is rapid antigen testing. So rapid antigen testing does detect Omicron. We have limited testing supplies countywide right now. We're recommending that people use rapid antigen testing for symptoms, not just for routine asymptomatic testing to offer reassurance, but really save those tests for when you're experiencing symptoms and treat a positive as a positive. If you get a rapid antigen test positive, you don't need to go get a PCR test to confirm it. They're highly accurate for positivity, especially if someone's having symptoms. If you are having symptoms after a known exposure and you're not able to obtain a test, presume that you're infected and isolate, and then test if you can at day 5 to end isolation. Again, surveillance testing for asymptomatic people is not recommended. And everyone can go to covidtests.gov, covidtests.gov, and get information about how you can secure tests. Every household can get 4 tests through the government now, mailed. I think they just started arriving. I spoke to a friend yesterday, and the post office they received their 4 tests. And then through your insurance companies, you're also able to get actually 8 tests per member, per household, per month, also through covidtests.gov. Next slide, please. Then I'll just end with an update on where we are with schools, and to our previous point of trying to maintain balance at every step. Our goals have been to keep our schools open. Fortunately, despite high community prevalence, our schools have remained stable thanks to the hard work of our parents, our teachers, our school administrators, our students. We're trying to make sure that our students can thrive, including both in school and also extracurricular activities. So the new guidance that we are revising today is that we are no longer limiting any gathering sizes in schools. We had limited indoor participation for indoor sporting events to 50 spectators, 25 per side. We are lifting that limitation today. And we are also moving to an optional response regarding outdoor masks. We had recommended that people use outdoor masks when they weren't able to maintain physical distancing as an effort to try and slow the spread of the very contagious Omicron variant. But we are now just leaving that as optional for our school communities. Next slide, please. So in summary, our peak of the Omicron surge is behind us. Our case rates and hospitalizations remain elevated. Our most severe outcomes are among those with known risk factors, especially vaccination status. We anticipate 2 to 3 more weeks of very high transmission rates, but declining. We are entering a new phase of pandemic response that will be characterized by layered strategies, balanced policies, and a focus on community. And our high vaccination rates are protecting us as individuals and as a community. Next slide, please. And that concludes my presentation. Thank you.
Thank you, Dr. Willis.